Okay, then let's briefly overview the VR applications in healthcare. Actually, virtual reality exhibit dual phases in healthcare applications. Uh, because different healthcare professionals have different perspectives and requirements for VR system. For, exa for example, in medicine domain, a VR system is considered as a collection of technologies that allow people to interact efficiently with 3D computerized databases in real time using their natural senses and skills. It is reported less than 20% of VR healthcare applications in medicine actually use any immersive equipment. This means that the surgeons and the doctors usually don't think rich interaction is an indispensable requirement of VR system. It is not a necessary. Immersion is not necessary a requirement. Actually, okay, I have been working with surgeons and doctors uh, many years. Based on my experience working with the doctors and surgeons, they usually think that if we can reconstruct a realistic uh, surgical environment or treatment environment or diagnosis environment to help them in diagnosis and treatment, it is enough. It is sufficient for their requirement. Rich interaction and immersive is not very necessary. So, but with the development of one of the main reasons of this is that the surgeons and the doctors usually don't want to change their working style. For example, they don't want to wear a head-mounted device in operating room, right? But with the development of technology, okay, there are some new surgical navigation systems have been developed, okay, using head-mounted displays, smart glasses, and trackers to locate the position of surgical instruments. So I think, okay, with the development of technologies, more and more surgeons and doctors will accept, okay, we introduce some new VR technologies, particularly some new uh, immersive equipment, okay, in the VR system to help them for more precise and accurate diagnosis and treatment, particularly when the current surgical procedures is more and more complicated. Okay, they really need new technologies to help them successfully conduct the complex surgical procedures. So on the other hand, for uh, clinical psychologists and rehabilitation professionals, VR is considered as an advanced form of human-computer interface that allows the users to interact with and become immersed in a computer-generated environment in a naturalistic fashion. It is reported immersive devices are used by more than 50% of the applications in behavioral sciences. So in behavioral sciences, okay, such as clinical psychologists and rehabilitation engineers, the immersion and interaction is very important, very important. In these applications, feeling of being there, specialized devices such as head-mounted displays, tracking systems, earphones, gloves, and haptic feedback devices is very important in many applications. Very important. So this is another phase of VR system in healthcare applications. So there are two versions of VR in healthcare applications. The first version of VR, okay, is come from the physicians and the surgeons. Okay, the physicians and surgeons think that if a VR system can present a virtual objects to all the human senses in a way identical to their natural counterpart, it is enough, it is sufficient. So as medical technologies become more information-based, it will be possible to represent a patient with higher fidelity. For example, we can use medical avatar as a surrogate for patient. And we can also offer realistic body parts or avatars that interact with external devices, such as surgical instruments. So in such a case, with the development of technologies, we can provide more and more realistic virtual environment for physicians and surgeons for better diagnosis and treatment. The second vision of virtual reality system is from the clinical psychologists and rehabilitation specialists. In their view, VR is used to provide a new human-computer interaction paradigm, not simply as external observers of images on a screen. The users are not just external observers. Users can actively participate within a computer-generated 3D virtual world. For example, many virtual reality-based systems have been developed to help users and patients recover their physical and cognitive functions, help the patients or users to recover the physical and all cognitive functions. In addition, in such a virtual environment, the patients can manage a problematic situation in virtual environment related to his or her disturbance. For example, some patients have problem in balance control. So we can construct a virtual environment to help them to train their balance control ability. So in such a VR system, the key characteristics is that there should be a high level of control of the interaction in such a VR system. The users should intensively or actively interact with the virtual environment, and enriched experience should be provided to the patient. So in the vision of clinical psychologists and the rehabilitation specialists, virtual environments are highly flexible and programmable, enabling the therapist to present a wide variety of controlled stimuli, such as a fearful situation, and measure and monitor a wide variety of user responses. For example, monitor movements or actions from any body part or many body parts at the same time. Virtual environment can provide input channel to the full range of human gestures. In addition, a VR system should provide systematic restorative training that optimizes the degree of transfer of learning or generalization of learning to the person's real-world environment.